Good morning all. Welcome to Bemax Academy's online session for pharmacists. Today we are going to discussing about essential, basic, important topic from the pharmacology, that's autonomic nervous system. Okay. Today let us focus on the cholinergic drugs and anticholinergic drugs. Here we can see. Okay. I am Dr. Swati, pharmacy trainer from Bemax Academy. Let us start the topic. Here we can see the a diagram that is about the nervous system. We know that the nervous system, it's an important part of our body that control all the process that happen in our body. Okay, all the functions that controlled by the nervous system. This nervous system we can classify as two. One is CNS and another part is PNS or peripheral nervous system. Okay. The whole nervous system we can classify as two. There is central nervous system and there is peripheral nervous system. The central nervous system that consists of the brain and spinal cord. Okay. The central nervous system that only consists the brain and spinal cord. If we use any CNS affecting drugs that act on the brain, otherwise that act on the spinal cord. At the same time, there is a total 43 pairs of peripheral nerves that arising from the brain and spinal cord. There is 12 pairs of cranial nerves and 31 pairs of spinal nerves that arising, and it collectively we can say it is a peripheral nerve system. Okay. Then again the peripheral nervous system we can classify as two. One is somatic nervous system, another is autonomic nervous system. The somatic nervous system that control all the voluntary process that occur in our body. Okay. That means our muscle movements, our physical activities, all the voluntary process that all the voluntary functions that controlled by the somatic nervous system. And the autonomic nervous system means that control the involuntary functions. That means involuntary functions means we know that our heart rate, our breathing, our digestion, these kind of involuntary functions occur in our body. All the involuntary functions that regulate, that controlled by the autonomic nervous system. Okay. This also autonomic nervous system again we can classify as two. There is parasympathetic system, another term we can use the cholinergic system, and another division is sympathetic system or that is adrenergic system. Okay. There is two divisions from the autonomic nervous system. Understand that autonomic nervous system that control the involuntary functions that happen in our body, and the autonomic nervous system we can again classify as parasympathetic system that regulated by the neurotransmitter acetylcholine through the muscarinic and nicotinic receptors. So, we can say it is a cholinergic nervous system. Acetylcholine is the neurotransmitter, so we can remember it is cholinergic nervous system. Okay. Then another division already we said, that is a sympathetic system. In the sympathetic system, adrenaline and noradrenaline are the neurotransmitters. So, we can say another term, that is the adrenergic nervous system. Okay. Once again, the parasympathetic nervous system mediated by the acetylcholine, that is cholinergic nervous system, and sympathetic division that is regulated by the adrenaline. So, we can say adrenergic nervous system. The parasympathetic nervous system act through the nicotinic as well as muscarinic receptor. At the same time, the sympathetic nervous system that regulate through the alpha and beta receptors. Okay. That is the main difference. Then we can look at here when the parasympathetic system will get activated. We know that another term we can use, that is rest or digest. When we are in rest or we are in digest, when we are in relax the system, that means the parasympathetic system gets start. Okay. That means during the rest or digest, during the rest or digest the parasympathetic system will get activated. Then when the sympathetic system will get activated when we are in an emergency situation or we have a stressful condition. For tackling the stress, to overcome the emergency situation, our body shift to the sympathetic nervous system to activate the adrenaline. Okay. The sympathetic nervous system mediated by adrenaline through the alpha and beta receptor. When actually that sympathetic nervous system gets stimulated during any stressful condition or if there is an emergency situation. Okay. That is the main difference from the parasympathetic system and sympathetic system. Okay. We can move to the slide. The cholinergic drugs. Okay, in this class we have to focus on the cholinergic drugs and the anticholinergic drugs. Here the cholinergic drugs that act by mimicking or enhancing the effect of acetylcholine. Okay. What is cholinergic drugs? Cholinergic drugs that mimicking and enhancing the actions or effect of acetylcholine through the muscarinic and nicotinic receptors. Okay. Here we can see acetylcholine is the main neurotransmitter in the parasympathetic nerves and that mainly the function that occur in the neuromuscular junction through the NM receptor, and another site is in between the neurons, that means in the sympathetic ganglia, in the parasympathetic ganglia. Okay. The acetylcholine is the main neurotransmitter in the parasympathetic nervous system. Main function occur in the neuromuscular junction. Neuromuscular junction means in between a neuron and a muscle fiber. Okay. So, in the neuromuscular junction there is an NM receptor, that is a type of nicotinic receptor, and another site is the various part of the CNS. In the CNS there is another nicotinic receptor, that is NN receptor, that is in between the neurons. Okay. Once again, the NN receptor that located in between the neurons and NM receptor that located in between the neuron and muscle fiber. Okay. That is about the cholinergic neurotransmitter. Here we can see already we discussed the autonomic nervous system that consists of total 43 pairs of peripheral nerves, the 12 pairs of cranial nerves and 31 pairs of peripheral nerves, that we can collectively say it is the autonomic nervous system. Here we can see the parasympathetic nerve innervations. The parasympathetic nerve arising from the both brain and spinal cord, and the nerve distributions we can see the cranial nerves coming from the brain, and they have the connection to the lacrimal gland, eye and salivary glands, and from the 10th cranial nerve, that is a vagus nerve that distributed to the heart, lungs, then liver, gallbladder, digestive tract, renal system and also reproductive system. Okay, that is a nerve innervations of parasympathetic system. Some nerves that are arising from the brain, that is the cranial nerve, the distribution go to the lacrimal gland, eye, salivary glands, and the vagus nerve. Vagus nerve is the 10th cranial nerve that distributed to the heart, liver, then lungs, intestine, digestive system, reproductive system, renal system, etc. Okay. That is a nerve innervations in the parasympathetic system. Okay. Then here in this diagram we can understand the difference between the parasympathetic functions and sympathetic function. Okay. In this diagram we can see during the parasympathetic system what happen in this eye, actually the eye will constrict, the pupil will constrict, the term we can say that is a meiosis. Meiosis means the pupil will constrict and the focus the light actually, okay, the accommodation and near vision will be occur in the parasympathetic system. Then what happen in the salivary glands during the rest or digest? Digest means we have the salivary secretion during the digestion. So, during the parasympathetic system salivary secretions will stimulate, okay, salivary secretion will stimulate and heart rate will reduce. That means when we are in the rest or digest, we are in the relaxed state. So, the heart rate will reduce, that means lower the heart rate. What happen in the bronchi? The bronchi will constrict, bronchial smooth muscles get constrict. Then during the rest or digest, what happen in the stomach? The stomach that stimulate the secretions, and what happen in the intestine? Intestine stimulate the peristaltic movement and also GI secretions will be there. What happen in the liver? Liver secrete the bile. Okay, bile is responsible for the metabolism of cholesterol. So, for the digestion of the cholesterol, the bile acid secretion will be there, and the intestinal peristaltic movement will increase, the GI secretion will increase. And what happen in the urinary bladder? Urinary bladder get constricted, urinary sphincter get dilated. Okay, the urinary bladder made up of detrusor muscles. So, the detrusor muscle gets constricted, urinary sphincter, that is a trigon sphincter get relaxed. Okay, these are the functions happening in the parasympathetic system. Once again we can see in the eye, what happened in the eye? The meiosis will be there. Meiosis means the ciliary muscles get constricted, the pupil gets constricted. So, meiosis will be there, salivary secretions will be stimulated, heartbeat will reduce, that means the normal heart rate will be there or the slower heartbeat will be there. What happened in the bronchi? All the smooth muscles get constricted, bronchial smooth muscles get constricted. What happened in the stomach? Stomach stimulate the digestion. Then what happened in the liver? Liver stimulate the bile acid secretion during the digestion. And what happened in the intestine? The peristaltic movement will be there, GI secretions will be increased. And what happened in the bladder? The detrusor muscle in the urinary bladder get constricted, urinary sphincter, the trigon sphincter get relaxed. Okay. Then urination will be there. These are the functions during the parasympathetic system. Okay. We can look here, that is a sympathetic nervous system. Sympathetic function means during the sympathetic function activate during the emergency situation or during the fight or flight, when we are on the flight or we have to fight against the situation, against an emergency situation, the sympathetic nervous system will get activated. What are the difference occur in the sympathetic nervous system? Actually, the eye will dilate, that means the pupil will dilate, that means mydriasis will be there. And what happened in the salivary glands during the fight or flight? The dry mouth in our body. So, the dry mouth means the salivary secretions will inhibit. What happened in the heart? Heart accelerate the heart rate, that means heart rate gets stimulated, and then tachycardia like symptoms will be there. And what happened in the lungs? The bronchial smooth muscles get dilated. Okay, the bronchial smooth muscles get dilated. And what happened in the intestine? The digestion will inhibit during the sympathetic system. That means during the fight or flight, the digestion will inhibit. Then in the liver, that stimulate the glucose production. Okay, the glucose release will increase. And what happened in the kidney? Kidney that stimulate the adrenaline and noradrenaline production. Okay, kidney that stimulate the adrenaline and noradrenaline production. What happened in the intestine? Intestine relaxed and urinary sphincter get constricted. Okay, these are the functions happening during the sympathetic system. We can compare the parasympathetic and sympathetic system and easily we can remember. Okay. During the rest or digest, parasympathetic system will be there. Then during the emergency situation, the sympathetic system or the adrenergic system get activated. Once again, what are the main functions occurring during the sympathetic system? In the eye, mydriasis will be there. What about the salivary secretions? All the salivary secretions, GI secretion, GI peristaltic movement, all the secretions will be inhibited during the sympathetic system. And what happened in the heart? Heart rise the heartbeat. Okay, heartbeat will increase, BP will increase, tachycardia will be there. And in the lungs, the bronchial smooth muscles get relaxed. And what happened in the stomach? The digestion will inhibit, peristaltic movement will inhibit. What happened in the liver? Liver stimulate the glucose release. What happened in the kidney? Kidney that activate the adrenaline, noradrenaline secretion. And then intestine that inhibit the peristaltic movement and intestinal secretions. And in the bladder, urinary bladder, the detrusor muscle will relax and trigon sphincter get constricted. Okay. These are the sympathetic and parasympathetic functions. Okay. Then go to the cholinergic drugs. Here we can see some directly acting cholinergic drugs we have. Directly acting cholinergic drugs means they have the ability to directly bind on the muscarinic as well as nicotinic receptors. So, the cholinergic agonist, the cholinesters, acetylcholine, methacholine, carbachol and beta-nacol, they are the choline esters. They have the ability to directly act on the muscarinic and nicotinic receptors. Then also we have some natural alkaloids that obtained from some natural plants. Okay. That's the natural alkaloids. The pilocarpine obtained from the Pilocarpus plant, and muscarine obtained from a mushroom, a poisonous mushroom, and aricoline obtained from the areca nut, and another we can say the nicotine that obtained from the tobacco. Okay. These are the directly acting cholinergic drugs. Once again, we have choline esters, acetylcholine, methacholine, carbachol and bethanachol. They are the naturally occurring choline esters, and also we have some natural alkaloids, muscarine, pilocarpine, aricoline. They are the natural alkaloid from some herbal source. Okay. Then here some indirectly acting cholinergic drugs means they don't have or they cannot bind directly on the receptor. They cannot bind directly on the muscarinic as well as nicotinic receptor, but they have the ability to enhance the acetylcholine activity indirectly. Indirectly means here is an enzyme cholinesterase. Cholinesterase, one of the enzyme responsible to degrade the acetylcholine. When we block the cholinesterase enzyme by using anti-cholinesterase drug, they indirectly they can enhance, or indirectly they can increase the availability of acetylcholine in the synaptic cleft. That means in between the neurons we can increase the acetylcholine level, and they indirectly they stimulate the cholinergic functions. Okay. So, anticholinesterase means they are the drugs responsible to inhibit the cholinesterase enzyme and enhance the availability of acetylcholine in between the cholinergic neurons. There is some reversible inhibitor of cholinesterase enzyme. That is a reversible anticholinesterase drugs are physostigmine, neostigmine, pyridostigmine, endrophonium, donepezil, rivastigmine, galantamine. They are the indirectly acting that means reversible anticholinesterase. Okay. The carbamates derivative physostigmine, neostigmine, pyridostigmine, endrophonium, donepezil, rivastigmine and galantamine. They are carbamate derivatives. They reversibly they inhibit the cholinesterase enzyme. Okay. Another one is irreversible inhibitor of cholinesterase enzyme. Irreversible inhibitor means they permanently or irreversibly they can block the cholinesterase enzyme. What are the examples? There is some carbamate derivatives also there. Some organophosphate drugs. Okay. Organophosphates, that means some poisonous substance, the diflose, ecothiopate, malathion, diacinone and other nerve gases, that is a tabun, sarin, soman. These are some organophosphate and nerve gases. These are indirectly acting anticholinesterase. Okay. Okay. Then about the classification of the cholinergic drugs. Directly acting cholinergic agonist. What are they? Act directly on the cholinergic receptors. Example, acetylcholine, bethanachol, pilocarpine and carbachol. Indirectly acting cholinergic agonists are cholinesterase inhibitors. Already we discussed. Inhibit the acetylcholinesterase enzyme and enhance the availability of acetylcholine, or increase the concentration of acetylcholine in the neuromuscular junction or in between the neurons. And reversible anticholinesterase are neostigmine, pyridostigmine, physostigmine and donepezil. Reversible cholinesterase inhibitors are ecothiopate, parathion and malathion. Okay. Then cholinergic receptors, we already discussed there is two types of receptors for the cholinergic action. There is muscarinic receptors and nicotinic receptors. There is 5 types of muscarinic receptors, M1, M2, M3, M4 and M5. Okay. 5 types of muscarinic receptors we have and 2 types of nicotinic receptors we have. Nicotinic receptors, that is NN receptor that located in between the neurons, and NM receptor that located in between the neuron and a muscle fiber, that means in the neuromuscular junction. Okay. Then about the muscarinic receptor, there is 5 types of muscarinic receptor, and we can remember the odd numbers of muscarinic receptor, that means M1, M3 and M5. Okay. Odd numbers M1, M3 and M5, they are the excitatory in nature. That means they are stimulatory in nature, and M2 and M4, they are the even numbers. M2 and M4, they are inhibitory in nature. For example, we can say the M2 receptor that located on the myocardium in the heart, during the parasympathetic action, the heart rate will be reduced. That means the inhibitory action on the myocardium. So, through the M2 receptor, there is an inhibitory action. Okay. The M1 receptor that located in the gastric mucosa. So, during the parasympathetic system, the gastric secretion will increase, peristaltic movement will increase. That means there is an excitatory action. Okay. We can remember the points. Different cholinergic receptors, the muscarinic receptors M1 to M5, M1, M2, M3, M4 and M5. The odd numbers are excitatory in nature. The even numbers, that means M2 and M4, they are inhibitory in nature. Okay. Found in the smooth muscles, heart and glands. Okay. Then nicotinic receptors found in the skeletal muscle, that is a NM receptor. That means in the neuromuscular junction there is NM receptor, and the autonomic ganglia, that is NN receptor. They are the different nicotinic receptors. Okay. Then pharmacological actions of through the muscarinic receptors. The cholinergic action through muscarinic receptors, that the muscarinic receptors located in different organs. So, organ system effect, what happened in the eye during the parasympathetic system. In the eye, meiosis will be, the meiosis means the pupil constriction will be there, accommodation for the near vision. Okay. Then what happened in the heart? Heart decrease the heart rate, that means bradycardia will be there. What happened in the GIT? That increase the peristaltic movement and increase the GI secretions that happen in the GIT during the cholinergic system. What happened in the bladder? Increase the urination, that means due to the contraction of detrusor muscle, due to the dilation of sphincters, trigon sphincters, the bladder get contracted and urination will be there. Okay. The bladder get contracted and increase the urination due to the contraction of detrusor muscles and relaxation of trigon sphincter. Then what happened in the bronchi? Bronchial constriction will be there. Okay. Can you see the bronchial constriction will be there? And what happened in the glands? Glands increase the secretion, increase the salivation, increase the lacrimal secretions. Okay. These are the pharmacological actions through the muscarinic receptors. Okay. The organ system effects are, what happened in the eye? Meiosis. Meiosis will be occur in the eye. In the heart, reduced heart rate and bradycardia. What happened in the GIT? That stimulate the peristaltic movement, that stimulate the secretions in the GIT. What happened in the bladder? The urinary bladder get constricted, urinary sphincter get dilated. So, urination will be there. Then bronchial smooth muscles get dilated, and glands increase the salivation and lacrimal secretions. Okay. These are the pharmacological actions of cholinergic drugs. Okay. The cholinergic action through the nicotinic receptors, we already said that the nicotinic receptor, the NM receptor, they are located on the skeletal muscle. So, the skeletal muscle contractions are there. The autonomic ganglia, stimulation of both sympathetic and parasympathetic system, that is depend on the site. Okay. That is NN receptors that present on the CNS due to the stimulation of NN receptor leading to the alertness and tremor that occur in the patients. Okay. There is two types of two actions we can say, we can discuss through the nicotinic receptor. If there is an NM receptor, the location of NM receptor in the neuromuscular junction. So, the skeletal muscle contraction through the neuromuscular receptor, and through the NN receptor, the CNS alertness will be there and the tremor will be there. Okay. These are the pharmacological actions of cholinergic drugs through the nicotinic receptors. Okay. Already we discussed the muscarinic effect and nicotinic effects in the cholinergic system. Okay. Then what are the therapeutic uses of the cholinergic drugs? Okay, here the bethanacol. Bethanacol, it is a cholinergic drug. They stimulate the urinary bladder and they enhance the urination. So, we can use for the management of urinary retention. Okay. Okay. Then pilocarpine. Pilocarpine is a natural alkaloid that mainly we can use for the management of glaucoma because it induces the meiosis. It induces the meiosis means we can use for the management of glaucoma. Then neostigmine. Neostigmine is an indirectly acting cholinergic drugs we can use for the management of myasthenia gravis. Actually, what is myasthenia gravis? Myasthenia gravis is an autoimmune condition due to the lack of NM receptors in our muscles. Okay. It's an unavailability of the nicotinic receptors in our muscle. The acetylcholine action will reduce and muscle weakness will be there. That is a condition of myasthenia gravis. So, we can use the neostigmine and reversal of neuromuscular blockage. Okay, neostigmine we can use for the management of myasthenia gravis. Another is physostigmine. Physostigmine we can use for atropine poisoning. Atropine means atropine is an anticholinergic drug. If there is an excess use of anticholinergic drugs, we can use the physostigmine as a drug of choice. Okay. Then donepezil we can use for the Alzheimer's disease, for the management of Alzheimer's disease. Donepezil is another indirectly acting cholinergic drugs, and due to the nicotinic action they can enhance alertness, enhance the CNS activities. So, donepezil we can use for the management of Alzheimer's disease, and ecothiopate. Ecothiopate we can use for the chronic glaucoma, but the ecothiopate is an organophosphate compound. Due to the toxicity we rarely use the ecothiopate. Okay. Once again, the therapeutic uses of cholinergic drugs, the betanacol we can use for the urinary retention because they have the ability to induce the urination, so increase the urination, so we can use for the urinary retention. Pilocarpine that induce the meiosis, so we can use for the management of glaucoma. Then neostigmine we can use for the management of myasthenia gravis, and the physostigmine we can use for the atropine poisoning, and donepezil we can use for Alzheimer's disease, and ecothiopate rarely used for the glaucoma, for the management of glaucoma. Okay. Then what are the adverse reactions, what are the adverse effects during the use of these cholinergic drugs? We know that if there is an excess use or excess overdose of these cholinergic drugs will lead to some side effects. What are they? Due to the excessive cholinergic stimulation, the sludge syndrome. Sludge means we can remember the code sludge. S for salivation, okay. S for salivation, L for lacrimal secretion, then U for urination, D for defecation, G for gastrointestinal upset, E for emesis. Okay, that's a sludge syndrome. Sludge syndrome means salivation will be there, lacrimation will be there, urination will be there, defecation will be there, gastrointestinal upset, emesis, that means vomiting will be there, and other symptoms like bradycardia, hypotension and bronchospasm that occur in the patient. Okay. These are the main adverse reactions of the cholinergic drugs. Okay. Then contraindications. What are the contraindications of cholinergic drugs? We know that already when if we use the cholinergic drug, it will lead to the bronchial contraction. Okay, the bronchial smooth muscles get contracted. So, if there is an asthma or COPD patient, what happens? If we use the cholinergic drug into a asthma patient or a COPD patient, again the bronchi get constricted. So, it is a contraindication. The asthma and COPD is a contraindication, and during the use of cholinergic drug, what happen in the stomach? It stimulates the gastric acid secretion. So, another contraindication is peptic ulcer. Peptic ulcer is another contraindication. And bradycardia, if there is a reduced heart rate, we cannot use these cholinergic drugs. We should avoid the cholinergic drugs in a bradycardia patient, and if there is a hypotension, we should avoid the cholinergic drugs. Okay. What are the contraindication? In an asthma COPD patient, we should avoid the cholinergic drugs. If there is a peptic ulcer patient, we should avoid the cholinergic drugs, otherwise that induce the gastric acid secretion and condition will be worsened. Then if there is a bradycardia or hypotension, is again there is a contraindication. Then mechanical obstruction and intestinal and urinary tract obstruction patients, we should avoid the cholinergic drugs. Okay. That about the contraindications again here antidotes for the cholinergic drugs. Okay. If there is a cholinergic activity, cholinergic toxicity, we should use some antidotes. What are the main antidotes we can use? If there is a severe excess cholinergic actions, we can recover by using the atropine. Atropine that block the muscarinic receptors to reverse the cholinergic actions, and another specific antidote is the pralidoxim. Pralidoxim that reactivate the acetylcholinesterase enzyme and they correct the cholinergic activity. Okay. Acetylcholinesterase reactivate due to the use of pralidoxim, and for the organophosphate mainly we use for the management of organophosphate compounds. Okay. For organophosphate toxicity. Okay. These are the antidote. Atropine as one of the first drug of choice for the organophosphate toxicity or any anticholinergic toxicity we can recover by using the atropine, and there is a specific antidote for the organophosphate compounds. They are the pralidoxim. Okay. That is a specific antidote for the organophosphate poison. Okay. Then in this chapter there is some, we can see the summary, the cholinergic drugs that enhance the parasympathetic activity used in glaucoma, myasthenia gravis and Alzheimer's disease, etc. Then the toxicity we can treat by using atropine, and the specific antidote pralidoxim we can use. Okay. That is about the cholinergic chapter. And we have to go to the anticholinergic drugs. Okay. The anticholinergic drugs are the agent that block the actions of acetylcholine by blocking the muscarinic receptors as well as nicotinic receptors. Okay. The anticholinergic drugs are the agents that block the actions of acetylcholine by blocking the muscarinic receptors. They inhibit the parasympathetic activity and producing the effect similar to that of the sympathetic system. Actually, that's we feel that's a opposite action of the cholinergic system, and they are similar. Some actions there is some similarity with the sympathetic system, but we remember that the sympathetic system is another system mediated by or regulated by the adrenaline or noradrenaline through the alpha beta receptors. Here the cholinergic system mediated by the acetylcholine through the nicotinic and muscarinic receptor, but the anticholinergic action just seem opposite, seem similar to the sympathetic activity. Okay. Once again, anticholinergic drugs are the agents that block the actions of acetylcholine through the cholinergic receptors. Okay. Then classification, naturally occurring alkaloids are there, that's atropine, scopolamine or hyoscine, another name we can say hyoscine. Atropine and scopolamines are the naturally occurring alkaloids, and semi-synthetic derivatives are homotropin and ipratropium bromide. Also synthetic analogues are available, glycopyrrolate, tropicamide and oxybutynine, they are the synthetic compounds. Okay. Once again, the classification of anticholinergic drugs, the naturally occurring alkaloids, what are they? Atropine and scopolamines are the naturally occurring anticholinergic drugs. Then semi-synthetic derivatives are homotropin and ipratropium bromide. Also we have some synthetic analogues of anticholinergic drugs, they are glycopyrrolate, tropicamide and oxybutynine. Okay. Mechanism of action of anticholinergic drugs, they competitively block the muscarinic receptors, that means they competitively antagonize the muscarinic receptors M1 to M5 and block the parasympathetic nerve impulses at the smooth muscle and cardiac muscles, glands, then result to reduce the secretions, smooth muscle relaxation and increase the heart rate. Just in this chapter we have to remember again there is a acetylcholine action during the cholinergic system, and we can compare the cholinergic effects with the anticholinergic action. Once we can remember, there is an acetylcholine action in the eye. What happened during the acetylcholine that bind or they act on the eye? There is meiosis will be there. Okay. The acetylcholine act on the eye, it will lead to meiosis. Okay. Then what happened in the that means atropine system, in the anticholinergic system, what happened if the atropine that act on the eye, it will lead to mydriasis. That means opposite action. Okay. Acetylcholine induce the meiosis, atropine, okay, same as atropine, the atropine and adrenaline both are same, both are similar action, but from two systems. Okay. There is anticholinergic actions of atropine, there is mydriasis, cholinergic drug, that means the pilocarpine like drugs, it will induce meiosis. Okay. Then go to the next system. During the cholinergic system, what happen in the heart? The heart rate will reduce, BP will reduce, and hypotension due to the action of acetylcholine. What happened in the anticholinergic action? What happened during the binding of atropine or another anticholinergic drugs on the heart? The heart rate will increase, tachycardia will be there. Okay. Then what about in the bronchi during the cholinergic system? If the acetylcholine that bind to the bronchi during the cholinergic system, the bronchial contraction will be there, so smooth muscles get constricted. What happened during the anticholinergic system? For example, we use the atropine derivative, ipratropium bromide or tiotropium bromide we use as an anticholinergic that relax the bronchi. So, we use for the management of asthma and COPD. Okay. We can compare these effects during the cholinergic system and during the anticholinergic system. In the cholinergic system, in the eye there is meiosis due to the action of cholinergic drugs. In the anticholinergic system, the atropine, it will induce the mydriasis. Then in the heart, the cholinergic drug that reduce the heart rate, that reduce the BP. Then what happened in the anticholinergic system, the atropine and their derivatives that stimulate the heart rate and tachycardia will be there. In the bronchi, the acetylcholine that contract the bronchi, and what happened in the anticholinergic system, the ipratropium bromide and tiotropium bromide that dilate the bronchi and decrease the bronchial secretions. Okay. What about the another secretions? In the salivary secretions and GI secretions and peristaltic movement, in the cholinergic system that gets stimulated. Okay, the cholinergic during the cholinergic system, the GI activity, the peristaltic movement, GI secretion, salivary secretion, all the secretion gets stimulated due to the cholinergic system. In the anticholinergic system, the secretions will be decreased and the peristaltic movement will be decreased. Okay. Then in the cholinergic system, what happened in the urinary bladder? The urinary bladder get contracted, urinary sphincter get dilated, and urination occur during in the cholinergic system. What happened in the anticholinergic system? The urinary bladder get relaxed and sphincter get constricted, and urinary retention that occur in the anticholinergic system. Okay, these points we have to discuss. Okay, pharmacological actions of different drugs in the anticholinergic system. Can you see in the eye? What happened in the eye? Mydriasis will be there, the dilated pupil, and cycloplegia due to the blockage of M3 in the iris and ciliary muscles. It will lead to the mydriasis. What happened in the heart? Due to the action of anticholinergic drugs, tachycardia will be there that block the vagal tone. Then in the GIT, what will happen? The motility, GI motility will reduce, GI secretions will reduce, and antispasmodic effect due to the use of anticholinergic drugs in the GIT. What happened in the respiratory tract? The bronchial dilation will be there, relaxation of bronchial smooth muscles, and also as secretions will decrease. Then what happened in the urinary tract? Urinary retention due to the relaxation of detrusor muscle and the contraction of trigon sphincter, it will lead to the urinary retention. Then what happened in the glands? Decrease the salivary secretion and sweat, then sweat and salivary secretions will be there. Sorry, the salivary secretion that decrease, dry mouth will be there, dry skin will be there, all the secretions get reduced. Then what happened in the CNS? Excitation or sedation depends on the drugs, atropine and scopolamine that induce a sedation. Okay. These are the anticholinergic actions, anticholinergic pharmacological action in different organs. Okay. What are the therapeutic uses of anticholinergic drugs? Okay. What happened in the eye? Mydriasis will be there. So, atropine like drugs we can use as a mydriatic agent. Okay, there is a mydriatic agent we can use. Then in the respiratory tract, COPD and asthma patients, ipratropium bromide and tiotropium bromide we can use as a bronchial dilator. So, for the management of COPD and asthma. Then what happened in the GIT? Antispasmodic effect. Antispasmodic effect induced by the hyoscine that produce antispasmodic action. Then in the urinary bladder, in the overactive bladder, oxybutynin we can use for the management of overactive bladder. In the CNS, if there is a motion sickness, we can use the scopolamine. Then as a pre-anesthetic medication to decrease the secretions, we can use glycopyrrolate. Glycopyrrolate is a synthetic anticholinergic drugs we can use as a pre-anesthetic medication. Okay. These are the therapeutic uses of anticholinergic drugs. Okay. In the eye, there is mydriasis. In the respiratory tract, there is bronchial dilation will be there. So, we can use for the management of COPD and asthma. In the GIT, antispasmodic effect will be there that relax the GIT, and urinary bladder we can use to relax the urinary bladder and overactive bladder by using the oxybutynin, and in the CNS motion sickness by using scopolamine. We can use the scopolamine for the management of motion sickness. As a pre-anesthetic medication we can use the glycopyrrolate, okay, to decrease the secretions. Adverse reactions are, we can say, anticholinergic reactions or atropine like effect. Atropine like effect, another term we can use, anticholinergic side effects. Dry mouth will be there, blurred vision, constipation, urinary retention, tachycardia, and also respiratory depression. These kind of effects that occur during the use of anticholinergic drugs. What are the anticholinergic side effects or atropine like effect? The dry mouth, blurred vision, constipation, urinary retention, and respiratory depression also there. Okay. Then what are the contraindications during the glaucoma, then prostatic hyperplasia, then prostatic hypertrophy, intestinal atony, and paralytic ileus, then tachyarrhythmia situations we have to avoid the anticholinergic drugs. Okay, these are the contraindications of anticholinergic drugs. In the summary, anticholinergic block the muscarinic receptors that reduce the parasympathetic activity used in ophthalmology, respiratory, urinary, and GI disorders. Must be used cautiously due to the systemic side effects. Okay. These are the points we have to discuss in the cholinergic chapter. There is cholinergic drugs and their pharmacological actions, their uses, their therapeutic uses, their ADR, their contraindication, and also antidotes we discussed. And in the anticholinergic system again we discussed about the pharmacological actions and side effects, therapeutic uses we discussed. Okay, this is about the cholinergic system. Then today we have to discuss some MCQ questions related to the cholinergic system. Okay, we can move to the first question. Can you see the first question here? A patient with glaucoma is prescribed the pilocarpine eye drops. What is the mechanism of action of this drugs? Okay, once again the question we can see, a patient with glaucoma is prescribed pilocarpine eye drop, and what is the mechanism of this drug? Okay, there is 4 options we can see. It is a muscarinic blocker, it is a muscarinic antagonist. Another option is nicotinic antagonist. Another option is muscarinic agonist. Another option is it is an alpha agonist. Okay, alpha adrenergic agonist. What is the right answer? Can you comment in this comment section? A patient with a glaucoma prescribed with the pilocarpine. What is the actual mechanism of pilocarpine in these situations? The muscarinic antagonist, nicotinic antagonist, muscarinic agonist, and alpha adrenergic agonist. What will be the answer? Can you see? It is an muscarinic agonist. We know that pilocarpine is a natural alkaloid. They can directly act on the muscarinic receptor and it stimulate the cholinergic action. It induce the meiosis, so we can use for the management of glaucoma. Okay. The next question is, a farmer exposed to the organophosphate pesticides develop the pinpoint pupil. Pinpoint pupil means meiosis will be there and salivation, excess salivation will be there. then muscle twitching will be there. What is the most appropriate initial treatment? Okay, once again the question, the farmer exposed to the organophosphate pesticide develop pinpoint pupil, salivation, muscle twitching. What is the most appropriate initial treatment for this patient? Okay, options: A. Physostigmine, B. Atropine, C. Pilocarpine, and D. Propranolol. Okay, go to the options: Physostigmine, Atropine, Pilocarpine, and Propranolol. What is the right answer? We know that the organophosphate is an indirectly acting cholinergic drug. If there is an organophosphate compound, if there is an organophosphate toxicity, it will lead to excess activation of overaction of acetylcholine, and the cholinergic functions will be increased. So, the salivation and constricted pupil will be there. So, which drug we can use as a first drug of choice for the organophosphate toxicity? That is atropine. Okay, atropine is the right answer. The organophosphate that inhibit the acetylcholinesterase, and that excess acetylcholine action will be there, overstimulation of muscarinic receptors will be there. If we use the atropine, that block the muscarinic effect, and after the atropine we can use the pralidoxin that reverse the cholinesterase enzyme, and if there is an excess acetylcholine activity, that we can inhibit, that we can block by using the atropine. And second option, as a second drug of choice, we can use the pralidoxin to reverse the cholinesterase enzyme. Okay. Then move to the next question, which drug is used to treat the myasthenia gravis? Myasthenia gravis already we discussed. Myasthenia gravis is an autoimmune disease. Our own antibodies that block the nicotinic receptors in the neuromuscular junction, and the muscle weakness will be there. What is the drug of choice for myasthenia gravis? Option A, atropine, B, physostigmine, C, neostigmine, and scopolamine. Okay, which drug we can use? Right answer is neostigmine we can use. Neostigmine is a reversible cholinesterase inhibitor that increases acetylcholine activity at the neuromuscular junction and improve the muscle strength in the myasthenia gravis. Okay. Here, why we use the neostigmine in this option? We can see another one, physostigmine, almost physostigmine and neostigmine with a similar mechanism, but we can remember the neostigmine that act on the peripheral region, that means in the neuromuscular junction the neostigmine will be act, but the physostigmine have some CNS effect. They can cross the blood-brain barrier and it will lead to some CNS effect. So, the neostigmine will be the right answer for the myasthenia. Okay. Then to the next question, the patient is given atropine before the surgery. A patient is given atropine before surgery. What is the purpose of this pre-medication? Okay, why we use this atropine before the surgery? What will be the answer? To increase the salivation, to cause the bradycardia, to reduce the respiratory secretion, to enhance the peristalsis. What will be the answer? Why we use this atropine or atropine derivative like glycopyrrolate during the surgery? What is the main purpose of the pre-anesthetic medication? We have to remember the point, to reduce the respiratory secretions during the surgery. If we use atropine or glycopyrrolate, any anticholinergic actions, anticholinergic drugs that block the muscarinic receptors and decrease the bronchial and salivary secretions and prevent the vagal reflux, bradycardia, and during the these effect during the anesthesia. So, these kind of atropine or atropine derivatives we can use as a pre-anesthetic medication. Okay. The next question is, which of the following drug can cross the blood-brain barrier and cause the central anticholinergic effect like confusion? Okay. Here once again the question, which of the following drugs can cross the blood-brain barrier and cause central anticholinergic effect like confusion? Glycopyrrolate, ipratropium bromide, atropine, and neostigmine. Which is the answer here? Atropine. Atropine it's a tertiary amine, it's a lipid soluble drug, so they can cross the blood-brain barrier and they will cause the CNS effect like delirium, hallucination in high doses, not in normal doses. If there is a high dose of atropine, it is a lipid soluble compound, so they can cross the blood-brain barrier and cause the CNS side effects. Okay. Go to the next question. Which of the following symptoms is not caused by the muscarinic receptor stimulation? Okay. Which of the following symptoms is not caused by the muscarinic receptor stimulation? Options: bradycardia, meiosis, bronchoconstriction and dry mouth. Which of the following symptoms is not caused by the muscarinic receptor stimulation? Okay, not caused. Which is that? Bradycardia, meiosis, bronchoconstriction and dry mouth. Which will be the answer? Actually, the dry mouth is not a cholinergic sign. If there is a cholinergic drug, it induces the salivation. Okay. The dry mouth is the effect during the use of anticholinergic drugs. So, the dry mouth, it's a muscarinic stimulation cause the increased secretion, not dryness. Okay. Actually, the anticholinergic drugs will induce the dry mouth. Go to the next question. A 60-year-old man with COPD, okay, a 60-year-old man with COPD is given ipratropium bromide inhaler. Its action due to, okay, we know that ipratropium bromide is one of the atropine analog. It's an anticholinergic drugs commonly we use for the management of COPD and asthma. What's the actual mechanism? Alpha 1 blockage, beta 2 blockages or beta 2 stimulation, or muscarinic blockage or cholinesterase inhibition. What is the actual mechanism of the anticholinergic drugs? All the anticholinergic drugs that block the muscarinic receptor. So, go to the action. The muscarinic blockage will be there. Ipratropium is an anti-muscarinic drugs that cause the bronchodilation by blocking M3 receptors in the bronchial smooth muscles. Okay, that will be the answer. Then go to the next question. Which of the following cholinergic drugs used to treat the post-operative urinary retention? Okay, the 8th question. Which of the following cholinergic drug is used to treat the post-operative urinary retention? Bethanacol, atropine, epinephrine and tropicamide. Which will be the answer? Which is the drug we use to reduce the urinary post-operative urinary retention? The right answer is bethanacol. Why we use the bethanacol? Bethanacol is a muscarinic agonist. It is a cholinergic drug. Due to the cholinergic activity, it enhances the urination, okay, to stimulate the bladder and to stimulate the detrusal muscles and increase the urination. So, we can use the bethanacol. Then, which anticholinergic drug is used in motion sickness? Which anticholinergic drug we can use for motion sickness? Options: atropine, scopolamine, neostigmine and pilocarpine. Which will be the answer? Anticholinergic drugs we can use for motion sickness. Answer will be scopolamine. Scopolamine we can use. Scopolamine that block the muscarinic receptor in the vestibular pathway and preventing the nausea, vomiting due to the motion sickness. Okay. Then the last and final question in this topic, a patient with atropine overdose present with dry mouth, dilated pupil, tachycardia and hallucination. Okay. A patient with atropine overdose present with dry mouth, dilated pupil, tachycardia and hallucination. Which drug can reverse the CNS toxicity? Okay. Which drug we can use to reverse the CNS toxicity? Option A, pralidoxin, B, physostigmine, C, neostigmine and pilocarpine. Okay. Which drug we can use? The physostigmine we can use, because the physostigmine is an reversible cholinesterase inhibitor. It can cross the blood-brain barrier and that increase the acetylcholine action that reverse both central and peripheral atropine toxicity. Okay. The physostigmine, they can cross the blood-brain barrier and they will cross the blood-brain barrier and they will increase the acetylcholine activity and it central and peripheral atropine toxicity. Okay. This will be the final question. Then I hope you all of you get a clear idea about the cholinergic drugs and anticholinergic drugs and their mechanism of action and all these MCQ questions.